Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will discuss the Ayurvedic herbal treatment of a disease known as Detrusor Acontractalia. Simply put, this is a disease of the urinary bladder in which the inner wall or the inner muscle of the bladder doesn't contract properly and the urine cannot be passed out as it should be normally. Now, usually there are different phases of this. In some people there is hesitancy. In short, the urine stream doesn't start. In some patients, the urine starts, but the stream is very poor or doesn't have any force. Or some patients pass out urine, but then they always have a feeling of something left behind or insufficient urine output. So this disease is something in which there is urine retention or the urine is not passed properly because of insufficient or poor contraction of the urinary bladder muscle. Now there can be several causes for this infection, some obstruction in the bladder, neck of the bladder, for example the prostate, or some metabolic disease, or some strong overwhelming infection or autoimmune disorder, some tumor, or it can also result from old age or some neurological disease. So the causes are quite different, and usually initially it was felt that this is a disease of old patients or aging population, but nowadays we are seeing a lot of young patients also who are having this disease, and most of the patients do not have any other disease, for example high blood pressure or no neurological deficit, no diabetes. But in most cases the cause can be subacute infection of the lower urinary tract. Now, because of now this disease can be very distressing to the affected person, and it can affect quality of life. Usually, there is no special or satisfactory treatment for this in the modern system of medicine. Now, the acute treatment of this is with inserting a catheter and removing the urine which is blocked in the bladder. Now, this can serve as a short-term solution. But in the long run it tends to cause recurrent infection, and it can also reduce the tone of the muscle further. So this is usually something which you don't encourage, and we try to get the patient off the catheter as early as possible. Now Ayurvedic herbal medicines are very useful for the treatment of the disease, and the medicines act directly on the bladder muscle. It can also help in neurological deficit. If there is prostate problem, then we can treat the prostate enlargement. So see the cause and then we treat accordingly. So usually medicine is required for say a periods ranging from about 3 to 6 months, sometimes 8 months. But in most patients with treatment of 1 to 3 months, the main symptom of improper urine passing is treated, and the symptoms start coming down, and the patient can pass urine properly or satisfactorily. In some patients we have seen that even with acute retention of urine, there have been very good results within just 5 days of starting Ayurvedic treatment. Now these medicines need to be given in high doses, and we need to see what the cause is. Accordingly the medicines have to be given, but nevertheless with about say 6 months, on an average 6 months of treatment, most patients get very satisfactory results, and then they are able to pass urine on their own without any support of medicines or without using a catheter. So this is a short description of Ayurvedic herbal treatment for disease of the bladder known as Detrusor Acontractalia. Let's meet in the next video. Goodbye.